The opioid crisis has become so widespread, the nation's top doctor just did something we haven't seen in 13 years.
Yeah, the Surgeon General issuing the first national public health advisory to try to fight that epidemic. Our Mary McGuire is in the newsroom. Why this might make a difference, Mary?
Well, Jason, in Minneapolis alone, first responders have seen more than 200 overdoses this year alone, and that's just in one city. This morning, the nation's top doctor is urging the public to help in the fight. Surgeon General Jerome Adams is urging more people, including family, friends, and those who use opioids, to learn how to administer and carry naloxone. The drug can reverse the effects of an overdose and is given through a nasal mist or an injection. Some argue the use of this life-saving drug is simply enabling an addict to keep on using, but the Surgeon General, he disagrees. He shared a story of a former addict whose life was changed after he was given it.
Jonathan's roommate had naloxone and rushed to administer the drug, saving his life. Because Jonathan was alive, he was able to get into treatment. With the help of a peer recovery coach and medication-assisted treatment, Jonathan has now been in recovery for 6 years and is himself a recovery coach. You know, if that's enabling, then call me an enabler.
Now, many states have passed laws to increase the availability of this life-saving drug, and in most states you can walk into a pharmacy and just ask for it even if you don't have a prescription. It's also covered by most insurance plans. CVS just announced it will automatically apply a coupon for the nasal spray for people who don't have insurance. Now, this comes as U.S. Senator Tina Smith is gearing up to speak at a summit on the crisis today here in Minnesota. Her team claims this is all part of her work to secure funding across our state to fight this drug overdose and addiction epidemic. Jason.
Mary, some people might be unfamiliar with what this drug does. If somebody in law enforcement suspects that someone's overdosing, but they're not, is there a problem with the drug being given to them?
No, I could take it right now, in fact, and it would have no effect on me. It only works when opioids are in someone's system.
Interesting. Mary, thank you.